We are live. Hello, everyone. I am Deanna Bryan, the program manager at Hope for HIE, and I am joined today by Dr. Matthew Harer, and he is a neonatologist at UW Health, associate professor of pediatrics at the University of Wisconsin School of Med and Public Health, principal investigator at the Harer Research Group, and so much more. I left a lot of other really impressive things out of that bio. Thank you so much for joining us today to talk about HIE and potential kidney impacts. Thank you.
You're welcome. Thank you so much for the invitation to be here today, and
Yes.
really excited to share a little bit about the kidneys.
Before we get into our questions, I would love if you could provide us with just a brief career overview, kind of your journey towards becoming a neonatologist and what led to you developing a special interest in caring for babies with kidney problems.
Yeah, absolutely. So I was born and raised in Wisconsin, did nearly all of my training here at the University of Wisconsin. I went away for my neonatology fellowship to the University of Virginia in Charlottesville. And it was there that I really fell in love with doing neonatal kidney research. I had a terrific pediatric nephrology mentor, Dr. Jennifer Charlton, who has the most enthusiasm for caring for neonates and kidney problems that I've ever met. And it really was contagious. So started doing some research with her, and then have been really lucky and fortunate to be able to continue to be involved in my own kidney research here at UW, but also be involved in a couple of national groups that allows me to collaborate with really smart people around the country to try and find ways to better care for babies and their kidney issues.
That's wonderful. And again, I've said it once, we're very grateful for your experience and you lending us some of your expertise today to kind of help our family members understand what's going on. So with that, we'll start going into kind of the relationship between HIE and any potential kidney impacts that may occur. And the first question we have is if you could elaborate on that connection between HIE and just in general, some of the potential kidney impacts that happen subsequently.
Yeah, very happy to do that. So we know that in babies who have HIE, that there is likely a period of time right around the time that the baby's born that there is a lack of blood flow or a lack of good oxygen delivery. And we know that it can obviously affect the brain, but it also can affect all of the other organs as well. And one of the major organs that it can affect is the kidneys. And one of the reasons is that normally right after birth, the kidney only receives a very small percentage of blood flow. So usually right after birth, around 4% of the total cardiac output. And over the course of the first week, that increases up to a baseline of around 10% of what the heart pumps out. So we know in that first few days when the kidney is already getting reduced blood flow compared to what it'll get in the future, that any disruption in that blood flow or oxygen delivery can result in the kidney having pretty significant injury, which then can affect the kidney's ability to function, filter the blood, maintain normal electrolytes, maintain a normal fluid balance. So it's a really critical time for the kidney. And whenever there's kind of a disruption of that normal birthing process, the kidney is at risk.
And does the severity of HIE, mild, moderate, severe, does that correlate with the likelihood and extent of kidney issues or kidney involvement?
Yeah, I don't think that it's perfect. I think that we don't always know exactly how the blood flow redistributes in the body. So sometimes when there is a severe brain HIE injury, there's not always severe kidney injury, but more often than not, it does correlate. So if you do have severe HIE, you're much more likely to have more severe kidney injury. And we do grade kidney injury kind of similarly, where we grade
Mhm.
it on a scale of 1 to 3, or where 1 is mild, 2 is moderate, and 3 is severe. So some of the grading of acute kidney injury follows that of what HIE is. But there are some babies who, for some reason, even when they have a moderate or severe HIE injury, their kidneys, for some reason, are able to continue to maintain function and may have no injury or only a mild injury.
Interesting. And in the NICU setting, which I know is something that a lot of our family members are very familiar with, what are some transient kidney issues commonly observed with infants or children with HIE?
Yeah. So the biggest and probably most important issue that families are likely to notice and recognize is that because the kidney usually gets rid of a lot of urine, and babies with kidney injury actually have reduced urine output, they can find that their babies get swollen or have increased fluid that sticks around in the tissues that the kidney is unable to eliminate. So the babies already after birth typically look puffy, but these babies who have the low urine output can also be really puffy and start to look really swollen. Um, the second most major things that you would typically see in a baby who has reduced kidney function is that the electrolytes in the bloodstream, so
Mhm.
things like sodium and potassium, can get really disrupted. And you might end up having a really low sodium value or a really high potassium value, which then can require interventions to try and make those more normal when the kidney is not able to. And then I think finally, one of the other electrolytes that we pay really close attention to is calcium. And in babies who have kidney injury, the calcium level can be both high or low. So you have to really pay close attention to the electrolyte levels. Typically, we recommend checking those probably every 6 hours during the
Mhm.
therapeutic hypothermia that's ongoing for the moderate and severe HIE babies, to really keep a close eye on that. And then really having the nurse at the bedside keep really close attention to the urine output and measuring that so that the medical team can be informed when it does get low, because then we can expect to see some of those electrolyte abnormalities.
I see. And then in terms of like more long-term outcomes or impacts, what are some of those kidney-related concerns for children who experienced HIE in infancy?
Yeah, this is a complicated question, but in neonates, we're concerned that those who have kidney injury in the NICU will have a higher risk of developing chronic kidney disease. And I think one of the major reasons that we think this is that we know from larger pediatric and adult studies where they look at those who have kidney injury and then follow them forward that they have a much higher risk of developing chronic kidney disease than the general population who doesn't have kidney injury. We are hopeful that maybe neonates have some resiliency, or maybe because their kidneys are still immature, maybe the kidney injury doesn't affect it to the degree where they for sure are going to develop chronic kidney disease.
Mhm.
But we certainly know from some long term studies of babies who have kidney injury in the NICU that they do start to show signs, even as early as 2 or 5 years, of starting to have some abnormalities in their kidney function that could down the road, either in childhood or in adulthood, lead to chronic kidney disease, which then can progress to the need for potentially dialysis or things like
Mm.
a kidney transplant. Um, we don't know what that percent risk is, and there haven't been a lot of very well done studies specifically in the HIE neonatal population. So, Dr. Grossman in Europe probably has done two of the very few studies where they look at specifically just babies with HIE and then how their kidney function is around the age of 10 to 12. And they looked at a couple different things. They looked at their serum creatinine value, which is what we use to predict what their kidney function is. And they actually found that at 10 to 12 years, about 20 to 40% of those babies did have an abnormal creatinine. So then they performed a second study where they looked at three or four other markers and then actually, if they were abnormal, had them follow up with a pediatric kidney specialist. And only a few of those 20 to 40% babies actually, on further analysis, truly had long term abnormalities.
Interesting.
So, so our hope is that we won't have babies that have a lot of long term kidney issues, but we think that the babies who have really severe kidney injury in the NICU, or sometimes you can even require dialysis for a brief period of time in the NICU, those babies are going to be at much higher risk. And when speaking to a few of my pediatric nephrology colleagues who have taken care of children for 20, 30 years, both in their experience, they've taken care of 1 to 2 kids who have had HIE in the NICU who have required childhood dialysis or a kidney transplant. So um, it's definitely a possibility, but our hope is that we can do things and develop new therapies in the NICU that might prevent that, or at least be able to screen better as kids get older to look for it.
Yes. Could you also provide some insights into the prevalence of chronic kidney disease among children who had HIE? kind of both with and without that need for dialysis or treatment? I know this might be similar to what you talked about too.
Yeah. So it's really hard. I think we don't know the answer to that question in
Mhm.
reality because all we have is data from just a single site. And it was just looking at kids at the age of 10 to 12. I think the ideal study would be is we enroll all the babies who are born with HIE. And then, like every 2 years, we measure what their kidney function is. We get a good blood
Mhm.
pressure, we measure how their blood is filtering, we look at if there's any extra protein in their urine that shouldn't be there. And if we had a large cohort of babies from around the United States or around the world where we did that every 2 years, then I think we'd really start to understand what that number truly is. But those studies, unfortunately, require a lot of money and a lot of resources,
Yes.
and haven't gotten up and off the ground yet. Certainly a hope of ours in the future to do something like that.
Mhm.
To really understand what is that prevalence. If I had to guess what the incidence of chronic kidney disease in babies who are born with HIE, uh, it's hard to say. Like by the age of 20, maybe 5%.
Mhm.
Um, we can compare that to babies with cardiac associated kidney injury, and we know that several of those go on to develop chronic kidney disease. So we can try and use other populations that might be somewhat similar, and do our best guess. But
Yes.
unfortunately for the HIE group, we just don't have any great studies to tell us what that
Right.
true risk is.
Right. And I know we'll talk about relevant research and kind of therapeutic development in a minute. But before we do that, we want to spend some time focusing more on like NICU follow up and for various kidney concerns. So, how do kidney conditions or concerns typically manifest as children with a history of HIE as they grow older and transition out of that NICU environment?
Yeah, that's a really great question. I think probably the number one thing that is going to occur is that the babies would develop high blood pressure or hypertension. So, the American Academy of Pediatrics actually has recommendations that for babies who are in the NICU and experience an issue like HIE, that they should have a blood pressure measured at each of their visits when they go home with their pediatrician or their family doc, wherever they're getting care. The problem is that it's really hard to measure a blood pressure in a 1 year old, a 2 year old.
Hmm.
Really, not until kind of the age of 3 do children really tolerate that blood pressure cuff being on, and can you get a real blood pressure. But I think it's important to at least make the attempt because that can be one of the earliest things that changes.
Yes.
Um, Other things that may pop up if a baby or a child has chronic kidney disease is that their growth may not be super great. So if if they start to fall off on the growth curve, the pediatrician or the family doctor may check labs that may reveal that the creatinine is a little bit high, or that their estimated filtration number is a little bit low. That could suggest early signs of chronic kidney disease. So I think blood pressure and growth are probably the first things that people would notice. Again, if the kidney is really having issues, you can notice swelling,
Mm.
and some of those things like that.
Yes. What are some common trajectories for renal health in these children, and how does medical management or intervention play a role in mitigating some of those long-term kidney issues?
Yeah, really great question. So we actually, several of us were at a conference 2 weeks ago where we tried to develop screening guidelines for high risk groups of babies in the NICU that we know have potential concerns for development of chronic kidney disease. Because right now there aren't great recommendations for what screening should be done, so that we can detect the babies who have kidney issues early on. Because we know already there's things that can be done that are going to slow the progression of chronic kidney disease and really allow the kidneys to function and last as long as possible. So, by controlling the blood pressure and keeping the blood pressure in normal range is really important. There are some other medications that can optimize blood flow to the kidney. And there, I think, are in the future, there's things that are now being done for adults and pediatric patients, that might be able to be applied to young children as well, that would continue to slow the progression of kidney disease. The other just kind of common things are maintaining a healthy weight, really trying to avoid obesity or the development of type 2 diabetes, because that can really add on to already kidney risks.
Mhm.
And then we know that there's some over-the-counter medications that actually can injure the kidney. The most common one would be something like ibuprofen.
Hmm.
So we certainly recommend to families whose babies have a risk of chronic kidney disease to utilize Tylenol more frequently than ibuprofen for common colds, fevers, pain, and things like that.
Yes. Um, Going back to research and therapeutic development, are there any recent studies or ongoing research that shed light on the relationship between HIE and kidney function?
So there's a lot of work, thankfully, being done for this, and Hope for HIE has done a great job of raising awareness, and I think getting researchers excited to study this area and providing resources for us to be able to do that. So I think the first thing that we're trying to do is really understand how to best define kidney injury in the NICU. So right now we use a definition that was developed in 2013, but we actually hope that we'll be able to even come up with a better definition moving forward. So there's some researchers like Dr. Gupta who are looking at actually when the creatinine level doesn't go down as we would normally expect it, that might also be kidney injury, even though we don't see a rise in the creatinine, which we typically see with the current definition. So if we can better understand which babies in the NICU actually truly have kidney injury, then we can do a better job of following each of those babies long term. So that's kind of one area. A second really exciting area is there's a couple different medications that are actually cousins of the medication called caffeine. So one of them is called theophylline and one of them is called aminophylline. Both of those medications potentially can be given in the first 6 hours of life and then actually improve kidney function and prevent kidney injury. So all of those medications actually improve blood flow to the kidney, which we know is the source of the issue in babies with HIE. The problem is that studies haven't been done in babies who are undergoing therapeutic hypothermia.
Mm.
So we really are trying to understand and do studies on the babies who are getting therapeutic hypothermia to make sure that these medications are safe and effective before we start to introduce them and recommend that everybody be giving them. But I think those two medication or three medications really could be game changers
Yeah.
and really reduce the rates of kidney injury in babies with HIE, which is probably around 50% right now. But it would be really great to get that down to 10 or 20%.
Right.
Um, the other area is really looking at other things that can help us diagnose kidney injury in the NICU. So there's a couple of different proteins in the urine that we can utilize to measure and understand better how the kidney is functioning. And then there's actually a vital sign or a sticker that can measure the oxygen level in the kidney. It's called NIRS monitoring. You put the sticker on the back where the kidney is located, and you can actually look at directly how much oxygen that kidney is getting and
Mm.
how much it's using. So we are hopeful that by following that, and you can have that be continuous, just like the heart rate or the pulse ox. And by looking at that, we can find early changes that might lead to kidney injury. So we can make clinical changes in real time that might help improve kidney health.
Yes. So it's wonderful to hear that there are ideas or research kind of in the pipeline. And I remember you mentioned the consideration of kidney impacts as a core outcome in therapeutic development. Could you explain a little bit more for our families what that means and or how it could lead to improved care and treatment?
Yeah, absolutely. So um, when people are designing a study, so let's say I was a brain researcher and I really wanted to test a medication that might improve brain outcomes as it relates to HIE. Really, most of the research on that study is going to be on the brain. So you're going to get brain MRIs, you're going to look at biomarkers that relate to the brain. Um, so, really, our suggestion from the kidney side is even if you're doing a study on the brain, it's really important to also then measure kidney function. So, while you're looking at the brain, it's really easy to get a blood pressure, to get a urine sample, and a small blood sample to measure kidney function. So, really, by doing a large study on the brain, we can also find out a lot more information on the kidney just by including a few kidney pieces. And even if it's not a therapy that's meant to improve kidney outcomes, just by chance, we may see that a therapy that's aimed at the brain might also help the kidney. Um,
Interesting.
and historically, people haven't always included the kidney in some of those outcomes when they do studies on other organs. So, as a part of my role in the Neonatal Kidney Collaborative, we are really advocating for studies that are being done on the national level at multi different sites to include kidney outcomes in any study that's going on in neonates, because we know it's really hard to do those studies, it's really expensive. So while we're doing them, we should also think about the kidney.
Yes, absolutely. And we always end by asking our doctors and guests, what are some of your favorite or recommended resources? So in this case, we're going to ask for something twofold. The first of which is, where can parents go, per your recommendation, to understand more about HIE kidney impacts and all the nuances that go with it? And then second, just staying informed about any advancements in research and treatment options.
Yeah, so these are really great questions, and I did a really deep dive on Google to see what I could find. And it really hurts me and pains me to say that there are not any great resources for families about neonatal kidney issues as it relates to HIE. Um, there's a lot of really great children's hospital websites out there that talk about kidney issues as far as acute kidney injury in children, and I think those are probably the best resources to utilize
Mhm.
currently, because much of what is in those web pages is really great information, and often translates down to the neonate. But I think there's other things that could be included specifically as it relates to babies with HIE,
Yeah.
that families would want to know about. So part of my role in the Kidney Collaborative is we've developed a website. It's called babykidney.org. And over the next year or two, we are working very diligently with our education committee to try and get family resources available on that website. And I think that would help to fill the gap. So we can talk about neonatal acute kidney injury. We can specifically talk about issues that might pop up for babies with HIE, and looking at any baby who has concern for kidney issues long term, what we should recommend for screening, what those parents should be looking for, things to
Mhm.
avoid like ibuprofen, trying to be a healthy weight as much as possible. Um, there are better resources out there for the medical community and medical journals. There's been some really nice review articles that specifically talk for 15 pages about what to
Yeah.
think about when caring for the kidney. So the medical providers can search for those and find those. But unfortunately, those are often behind a firewall that only academic institutions have access
Right.
to and
Right.
are not what we call open access that anybody could look at and read. I'm, of course, happy to share those resources. If families really are curious and interested, please reach out to me. But it's really a gap, I think, right now,
Yeah.
for families. So I can understand not under knowing much about it because there really isn't anything to read specifically about it.
Right. And that's kind of, one of our goals is health literacy. And just part of that, as you mentioned before, is just raising awareness too, and just letting people know that this is a gap area and that there is more work to be done. But at the end of the day, again, we're grateful for people and medical professionals like you who are recognizing that and doing what they can to build those resources for our families. So, on that note, thank you so much for being here. And we're grateful for your time. And we will turn this into a blog, we'll turn it into key takeaways. And we can't wait to kind of see what you guys do and just to learn more about all that's going on and hopefully get a little bit more involved with some developments for HIE and kidney impact. So thank you.
Yes, of course, happy to be here, and we will continue to do our best through research and educational resources to help out the community.
Absolutely. Thank you.
Of course.